And welcome to the Dr. Bob Show. We'll be spending this show talking about a little gland in the neck, an important gland, a gland that may make you feel tired and make you feel listless and no energy and dry skin. Or the same gland can make us feel nervous, make us where heat really bothers us, make us where we perspire, where our heart races. The gland is the thyroid gland. My guest is Dr. Bill Law. Dr. Law is a board-certified endocrinologist, and he'll be answering our questions. Hello, I'm Dr. Robert Overholt, and I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about at what age should you begin to worry about your heart where you can do something about it, and carotid ultrasounds. What are they, and what information do they give us? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Bill Law, board-certified endocrinologist, and we're going to be talking about a gland in the neck. Bill, welcome to the Dr. Bob Show.
Thank you, Bob.
Tell me, where is the thyroid gland? Is it an endocrinology gland?
Absolutely.
And tell me about it.
Well, it's a little gland. I've got a to scale model. This is about the right size for an average size adult. It's a little gland here in the low front part of the neck below the voice box. It kind of wraps around your breathing tube, the airway, and then the swallowing tube sits back behind it, and the main blood vessels are right next to it. So there's a lot of real important things all clustered there in the low front part of the neck.
Is that thyroid gland important? It looks awfully little to me.
It's awfully important to me.
So, what does it do for the body, and how is it going to cause people problems?
Well, it makes a hormone. As far as we know, there's only one reason for it to be there, and it's to make a hormone, which we call, of course, thyroid hormone. And thyroid hormone circulates in the bloodstream in very precise levels, and they may vary from one person to the next, just like height may vary from one person to the next. And it affects a huge number of your metabolic processes, how fast or slow things are happening.
So if it's fast or slow, a lot of people complain of they're just tired and they're sluggish and they don't feel good. Can that be thyroid, or is that just something else?
Well, certainly thyroid can make those sorts of symptoms worse if you don't have enough of it, or strangely enough, if you have too much. Thyroid hormone needs to be sort of like the three bears in the porridge, not too hot, not too cold, just right. And too much or too little can cause decrease in your energy level. The problem is that if you go to the mall today and you do a symptom survey, totally anonymous, don't have to sign your name, your mother's not looking over your shoulder, just between you and God, and it asks questions like, how's your breathing? Any trouble with your bowels? Any difficulty with headaches? And buried in that list of questions, there's one that says, are you constantly tired and exhausted? Do you know how many people, what percent of people will circle that yes?
I would say almost everybody.
About 80 or 90%. It's amazing. So the point is, it's not, being tired can certainly be, any predilection can be made worse if you have too much or too little thyroid. But if 80 or 90% of the general population feels exhausted, what I tell patients is, when I fix your thyroid, I'm going to get your thyroid perfect, you only have an 80 or 90% chance of feeling exhausted.
So what does that mean? You can get the thyroid better, but they still may have exhaustion from something else?
Absolutely. Lots of different causes for any of the symptoms that you might read on the internet or some other source that are associated with too much or too little thyroid. They're very nonspecific.
In a way, we used to call this a sophomore medical student's illness from a standpoint. You feel tired, irritable, forget things, stumble a little bit. Could some of that be thyroid, or could it be part of just everybody?
It could be part of just everybody, but you don't know that unless you do the test. And the tests for thyroid disease now are very, very reliable. If you go back 20 or 30 years, it was a little sketchy, but now they're very consistent from one lab to the next, from one part of the country to the next, and very sensitive. And the nice thing about thyroid is, if you've got a problem, it's easy to diagnose if you order the right test, and we have very excellent treatment. So you don't want to miss it because you can treat it so well.
I'm dying to ask you, what's the name of that test? There is a test that will tell you whether the thyroid is doing a good job or a bad job?
Mm-hmm. And it's a very easy test. It's called TSH, which stands for Thyroid Stimulating Hormone. It's the thyroid is the production of hormone should be controlled by the master gland up here in the brain, the pituitary gland. And the system works sort of like a cruise control. It's like a thermostat on a heater. It's a closed loop feedback system, and you got a set point, and it's like height, you know. You might be this tall, and I might be this tall, but if you try to make me that tall, I'm going to have a strung out day, and vice versa. You know, everybody is different normal, but whatever your normal is, that's determined by God, and that's up here in your pituitary. And so if your pituitary feels that your thyroid levels are not enough for you, it increases that stimulating hormone. Like if the car is going below your expected speed, you give it more gas.
So the TSH gets higher because it wants the thyroid gland to put out more hormone?
Absolutely. It's like...
Does it do a good job?
Well, if the thyroid's able to respond. But sometimes you're whipping a tired horse. If you have thyroid disease, you see.
So what happens if the thyroid gland's overactive? What happens to that
The
TSH?
opposite. It's like if you're going faster than you want to go, you take your foot off the accelerator. The TSH goes down. I actually saw a patient this morning, a new patient, whose doctor had very astutely checked that and found that it was very underactive. And then when you start talking to the patient, she's got a lot of little symptoms that nothing real dramatic, but it could easily lead to an abnormal heart rhythm or accelerated osteoporosis. Too much thyroid is actually a lot riskier to your health than too little.
So hyperthyroidism may be more risky to your health than hypothyroidism. What are some basic symptoms of the overactive thyroid?
Overactive tends to be a lot easier to diagnose because the symptoms are more typical. They're less common in the general population, but people will frequently notice a change in their ability to tolerate heat or cold. They feel warmer than they used to feel.
Isn't that hot flashes?
Well, of course they can sweat more. So when I see a patient walk in to see me in January and they got a short sleeve shirt on, I'm looking at their neck, buddy, let me tell you.
So what does the neck look like if it's an overactive, if the thyroid's been, does it get different in size?
Vast majority of people that have an overactive thyroid also have an enlarged thyroid. It gets bigger, called a goiter. That's the medical term for an enlarged thyroid.
Can a person see their thyroid move if they look in the mirror, or if you're looking across the table at somebody's neck?
Very frequently. You just have to know where to look.
But it's right below the Adam's apple in that area?
Actually, it's not that hard. If you can feel the tip of this cartilage here, because it's the most prominent thing, and you go down and there's this little ridge, which is called the cricoid cartilage, and 99% of people, that thyroid is just below that.
Can you feel that gland if it's normal? Can you feel it if it's too big?
Oh yeah.
Can you feel it if it's not functioning well?
No, and that's an interesting topic, because you would think that the bigger it was, the more active it'd be, and the smaller it was, the less active. Totally wrong. There's a complete disconnect between how much hormone a thyroid gland makes and how big or lumpy or lopsided it is. You can have very large goiters that are underactive, or you could have a goiter or thyroid that's perfectly normal in size, that gets up and puts on a long cape and a shirt with an S on the front and just cranks out thyroid hormone like crazy. So the structure and the function don't mess up.
So tell me about why an underactive working gland would be bigger. What's this TSH doing, and why is it getting bigger? The goiter, you said. Not the overactive, the underactive.
Underactive. So a lot of times what happens is the thyroid's not able to make thyroid hormone as efficiently as it should, and so the pituitary has to increase the stimulation, trying to whip it and make it more thyroid. Well, that stimulation, in addition to stimulating it or trying to stimulate it to make more hormone, can also stimulate it to grow.
And so then it gets a big thyroid goiter.
And that's one of the reasons you want to be treating it pretty aggressively so that you can hopefully put this thing to sleep, not have to have it operated on.
Bill, can the thyroid gland be responsible? You mentioned osteoporosis and for some other problems, like cholesterol problems. Can the thyroid gland be involved with that?
Absolutely. In fact,
and that's what we're going to be talking about when we come back. How can the thyroid gland be involved with other parts of the body, like your heart, like your bones? A lot of information. We're talking with Dr. Bill Law, board-certified endocrinologist. We are talking about the thyroid gland and how it's important to your metabolism, how good you feel. Is there too much thyroid, too little thyroid? The important part is getting the test to know, and that test is a TSH, thyroid stimulating hormone. Bill, is that right so far?
absolutely.
Now tell me, is the thyroid or thyroid problems more prominent in women or men, young people or old people?
As a generalization, their thyroid trouble is much more common in ladies. Actually, it's about 7 to 1. One of the few things ladies get more than men. We get the short end of the stick on most things. That's why there's a lot more old ladies than there are old men.
Yeah, that's right. The women live longer.
Yep.
So if there's more thyroid problems in women, what are the symptoms that they have? Because, you know, if we say the thyroid is because you don't feel good and everybody in society doesn't feel good, what's the key issue? If somebody comes into you and says, I don't feel good, I'm tired all the time, I just know it's my thyroid, what's the pearl?
You have to assume that it's due to an underlying treatable, diagnosable problem until proven otherwise. Obviously, symptoms are common and they're not specific. So that's why you have to do the test. Now, if you do the test, you do the right test, and the test is absolutely normal, then with confidence you can say, not the thyroid. But you gotta do the test because the thyroid can affect so many parts of the body. You know, a lady may develop irregular periods. Well, you know, the doctor might think, well, it's probably just, you know, menopause or stress or something. But it could be too much or too little thyroid. Can cause the menstrual function to go screwy. So you have to do the test. That's
So if somebody's got irregular menstrual cycle, thyroid, the TSH is a good test to get. Let's talk about, let me throw out cholesterol. Can the thyroid gland be involved with cholesterol? What if somebody what if somebody has an elevated cholesterol? Shouldn't you just put them on medicines?
If they had a headache, would you just put them on aspirin or would you look for that brain tumor first?
Oh, so you
always look for an underlying cause before you treat the symptom. Thyroid, too much thyroid drops the cholesterol low and not enough makes it go up. Well, you don't want to just be taking a drug for high cholesterol. If it's due to not enough thyroid, you treat the thyroid and the cholesterol gets a lot better on its own.
So if somebody's got a high cholesterol and maybe tired and dry skin, TSH is an important part of that evaluation.
Before you even think about prescribing a cholesterol drug.
Okay, let's just say I'm tired all the time. My next door neighbor had low thyroid and they gave her thyroid and she did better. I need some thyroid. Will thyroid help everybody that doesn't feel good if they take a thyroid tablet? Is that good or bad?
Absolutely not. It only helps if you are deficient in it. If you're not low, and remember that thyroid, it's a normal thyroid is going to make a normal amount of thyroid. But if you give thyroid hormone the thyroid just kind of takes a break. It's just sort of like that car, you're driving on level ground, you come to a steep downhill. Well, you can take your foot progressively off the gas and the car still keeps going the same speed. So they only get into trouble if you take more than you need.
So if your thyroid's doing normal and you get a thyroid tablet and still hasn't improved things and you double the dose, can that be harmful if you're really giving the person sky-high thyroid by mouth?
Well, the heart specialists love it when you do that.
What does it do to the heart?
Well, because the patient typically will go into what's called fibrillation of the heart. The heart is very sensitive to too much thyroid, and it just starts quivering, and so it doesn't pump well. And all that blood coming back from the rest of the body just builds up like water behind a dam straight into the lungs. Boom, you go into congestive heart failure. So bad for their health, my reputation, we try not to let that happen.
So is it a low thyroid, overactive thyroid that causes heart failure? Both of them?
Well, severely low can cause you to retain a lot of extra fluid, and the heart gets real sluggish. It doesn't pump well just because it's flaccid, But that's really severe hypothyroid, underactivity. Too much thyroid, it doesn't take a whole lot too much thyroid to overstimulate the heart. It's much riskier to have too much.
There's a condition called, it's a long medical name, SVT, supraventricular tachycardia. Mm-hmm. The heart begins to race away. Mm-hmm. Can that be due to thyroid?
Very, very definitely yes. In fact, that's too much thyroid is one of the first things a good emergency room doctor looks for if a patient shows up and they've had trouble with real fast heartbeat.
Same thing with atrial fibrillation. Mm-hmm. That's a very, very common problem. So if you've got irregular heart, how about extra beats? How about my heart palpitations?
Same thing.
So
you've got to do the test.
And the TSH is the test. Mm-hmm. And it's easy and it's accurate. Mm-hmm. So we've talked about cholesterol. It's important to get that test. We've talked about heart problems. How about bone problems? I wouldn't think the thyroid would involve how healthy our bones are. What happens?
Too much thyroid stimulates the bone cells to dissolve bone more rapidly. Normally, bone is very active tissue. It's like the old Army joke about dig a hole, fill it up, how you keep the privates busy. Well, the bone is old bones constantly being metabolized and new bone being laid down. But if you get that process too souped up, you end up digging more holes than you fill, and it accelerates the loss of bone and can lead to severe osteoporosis.
And when you get severe osteoporosis, not enough calcium in the bones, not enough network in the bones, what happens? Crack?
It's like your accordion.
And so the vertebra can collapse, the bones can break. That's thyroid. Cholesterol can be thyroid. Heart failure can be thyroid. It seems like the thyroid, you need to be sure you're evaluating that on almost any problem. Visual problems?
Absolutely.
What kind of eye problems with an overactive thyroid?
Many people with an overactive thyroid will get a little prominence like this.
Dalrymple stare?
Yeah. But that's not really a disease. That's because the high thyroid levels are kind of just stimulating the muscle that raises the eyebrow to pull back a little bit. And that goes away when you fix the overactivity. But you can have a condition called Graves' disease of the eyes that actually causes a buildup of the muscle tissue, and it could cause the eyes to bulge way out of the bony socket. And that can be very, very annoying. It's uncomfortable, you get double vision, all puffy and red and feels pressure all the time. So that's a much more concerning problem.
This test is called a TSH. Mm-hmm. Is it almost something that everybody should have at least how often?
Well, it depends on what, if any, symptoms you're having.
Most people don't feel good.
If you don't feel good, you need to have it checked. But if it's normal, then you've shown that the not feeling good is not due to abnormal thyroid levels. So then it's just back to, okay, has there been any change? Because if you have a change, then it's worth checking again. But you don't want to be doing unnecessary testing. You want to do it and be sure that you've either confirmed or refuted the diagnosis but you don't want to drive it into the ground, so to speak.
Bill, your bottom line advice to people on evaluating their thyroid?
When in doubt, check it out.
When in doubt, check it out. Bill, you're a great teacher. I love having you on the Dr. Bob Show. Thank you so much for coming.
My pleasure, Bob.
Remember, if you're in doubt, check it out. That's the TSH, and stay tuned because we're going to be talking about when should you start worrying about doing something to prevent heart disease, and ultrasounds if we have time, carotid ultrasounds. Why would you want to get one? A lot of information for you. I want to thank Dr. Bill Law. Wonderful discussion on evaluation of symptoms and how they pertain to the thyroid. Thanks, Dr. Bill Law. And now for questions from you, the viewer, that I think will be important to your health. Dr. Bob, question number 1. Dr. Bob, at what age should a person begin to start worrying about their heart to protect it? That's a great, great, great question. And really, we should start at a very, very early age, let's say pre-teen age. That's where we start exercising. That's where we start watching what we eat. That's where we start evaluating our body mass index, how heavy we are. You know, people can have elevated cholesterol at a very early age, and if we get overweight, it's harder to exercise. It's harder to lose that weight. So we should start at a very early age. As we get into the stress of life, that's almost all the time, maybe age 30 or 40, that's a time where you need to look at your risk factors for heart disease. Let's go over some of those. Age is one, you can't control that. Gender is one, you can't control that. Cholesterol, everybody needs to know what their cholesterol level is. You got to know what the good cholesterol is and the bad cholesterol, and get on the program with your doctor. Know what your blood pressure is. 120/80 is the normal blood pressure. If your blood pressure is higher than that, then talk it over with your doctor about what needs to be done. And it's going to be exercise, eating properly, getting rid of salt, and lots of things you can do to control that blood pressure. If you're smoking, stop smoking. It's the biggest thing that you can do to cut down on diseases of the lungs and the heart, the stomach, the throat, everywhere. So if you smoke, you know, you got to stop. Talk that over with your doctor. People that are inactive and that are overweight. If you're overweight, there can be several causes of that. Work out that problem with your doctor. If you're inactive, if you're a couch potato, know that you need to work out that it doesn't take much. It's just getting your tennis shoes out and walking out the door in the morning. You don't have to go to the gym. You don't have to do anything. You can walk around in your neighborhood, but know that exercise is one of the things that keeps that heart healthier. As we get older, we need to be aware of our heart and our blood pressure and osteoporosis, our bone health. So they're at early ages when we start doing things that can prevent heart disease. Question number 2, Dr. Bob. What is a carotid ultrasound? The carotid arteries are 2 big arteries in the neck. They supply blood flow to the brain. If something happens to those 2 big arteries, then we may not get enough blood to the brain, and that could cause some problems. So if we start getting hardening of the arteries from elevated cholesterol, from the LDL being too high, or even genetics or triglyceride, then it could be that your doctor hears a bruit in the neck, and that means he can hear the blood flow. That's abnormal. The carotid ultrasound is a ultrasound. You just put this little device over the neck, and it will be able to tell how round that carotid artery is, and it will tell the doctor if you need to work on opening that up. Now, the brain is so great that if one side gets narrow, the other side can sort of take over circulation. It's called the circle of Willis. And the brain, the blood vessels do a great job of keeping your brain in good shape. But know that things can happen. Strokes can happen. So know that a carotid ultrasound will be able to guide you to have good blood supply to your brain. Well, that's all the time that we have for this show. Remember those 4 things that we like. It's exercise. Wow, how important that is for heart and to keep your blood vessels under good control. It also takes away stress. It also helps us lose weight. It helps us feel better. We get a runner's high. We get mentally active. So that exercise, we need to do it 30 minutes. We need to do it 6 or 7 days a week. Be sure you get that much exercise. Get a Fitbit. Get something that encourages you to exercise every day. Start the day off with fruit and fiber. What we eat is very, very important to keep our weight down, to keep antioxidants going. So we want fruit and vegetables, less red meat, more chicken, more fish, less volume. Eat properly. Make your snacks good snacks. 8 hours of sleep, 7.5 hours of sleep. The body will nourish itself. You'll feel better. You'll perform better. Studies have shown if you don't get enough sleep, it bothers the rest of your health. Don't be macho. Don't think you can get by on 4.5 to 5 hours of sleep. Studies show you will need more than that to stay healthy. And most of all, what do we like in the Dr. Bob Show? It's that laughter in your life. Find that patient or that person that you love that you can laugh with and tell stories. Laugh and giggle and read funny stories and laugh a lot. You'll be happier. People around you will be happier and you'll be healthier.